My name is Frank Kavishe. I'm the chairperson of the High-Level Research Coordination Task Force on COVID-19, and I'm here today to present some of the highlights of what the task force has done so far. I would like to acknowledge the presence of the Minister of Higher Education, Technology and Innovation, Honorable Dr. Ita Kanji-Murangi, the Minister of Health and Social Services, Honorable Dr. Kalumbi Shangula, and all the invited guests, and including Dr. Govinda, who is the chairperson, the deputy chairperson of the task force. As I present the highlights of the task force today, I would like to take note that several thematic research teams have done several activities as projects. As an example, we have the team on diagnostics, which has already received donations of equipment, PPP, and consumables for diagnosis, and they continue to carry out research into alternative methods of diagnosis. We have the team on the development of natural products that has started to carry out fieldwork to collect possible medicinal plants that could work against COVID-19. We have the teams working on sanitation and innovative solutions who have developed high-quality sanitizers as well as prototypes for face shields, amongst others. But today, we are here to witness a product which was developed by the thematic team on epidemiology and forecasting using ICT. The team on epidemiology and forecasting, which is headed by Professor Anisha Peters, has developed several technological solutions that will be used to manage COVID-19 cases. These solutions have been put together into a suite called the Case Management and Surveillance Technology Solution Suite. Since the suite will be mainly used by staff of the Ministry of Health and Social Services, some individuals of the ministry were involved during its development and testing. It is therefore my pleasure to invite the Honorable Minister of Higher Education, Technology and Innovation, Dr. Ita Kanji-Murangi, to make some remarks and officially launch the case management suite, and thereafter to hand over the case management suite to the Honorable Minister of Health and Social Services. Welcome, Honorable Dr. Ita Kanji-Murangi.
Director of Ceremonies, Honorable Minister of Health and Social Services, Dr. Kalumbi Shangula, the epidemiology and forecasting team, members of the media, good morning. On the 17th April 2020, I launched the high-level Inter-Institutional Research Task Force on COVID-19. Professor Kenneth Matengu is the head of the task force on COVID-19, and Professor Frank Kavishe is the chairperson, deputized by Professor Govinda. This COVID inter-institutional research team functions as the higher education sectorial response to the COVID-19 pandemic, and it has members from our two public universities, the NCRIST, which is the body that coordinates research in the country, and also members from the private sector. Several thematic areas have been identified with different projects and teams. The thematic areas are as follows. 1, COVID-19 diagnostics. 2, epidemiology and forecasting. 3, behavior change communication. 4, economic impact of COVID-19 on Namibia. 5, product development. 6, relationship between A, B, O blood groups and COVID-19. 7, improved water and sanitation facilities. And lastly, 8, innovation solutions addressing COVID-19. Honorable Minister, the thematic area teams have been working around the clock alongside your ministry and several different entities to find solutions to combat COVID-19. I am pleased to inform you that today we gather here because we have some results. One of the thematic areas is epidemiology and forecasting, led by Professor Anisha Peters. And this thematic area has different projects, as we have heard from Professor Kaveshe, some of which are data modeling, case management, surveillance technology solutions, as well as vulnerable community outreach initiatives. Members of this thematic area consist, among others, of NAST, UNAM, UNDP, Green Enterprise Solutions, CRAN, Namibia Statistics Agency, Ministry of ICT, and the Ministry of Health and Social Services. Honorable Minister, during this time of COVID-19, we realize how reliant we are on technology, and that we are indeed in the midst of the fourth industrial revolution. You might recall that members of this particular team has also developed the national COVID-19 website, which goes by the address www.namibiacovid19.gov.na. And also, they developed a mobile app containing essential information and updates about the virus. And this was launched during the first lockdown announcement. And I believe it is you, Honorable Minister, and your team who will attest to the utility of these two earlier developments. This very team, along with your health workers, has now successfully developed a COVID-19 case management and surveillance technology solutions suite. The technology suite enables health workers to provide management and support services to citizens and patients via mobile phones. It complements their existing systems and data to manage the pandemic. The suite also enables surveillance of the pandemic across Namibia, and the suite consists of self-assessment and reporting app for the general public, daily patient diary app for reporting an emergency alert system during quarantine, health worker portal for managing patients, facilities, and reporting, executive dashboard to provide insights at a glance of the various metrics, locations, and data, and Homeless Persons app to register and manage the needs of the persons in need of shelter. As mentioned before, these technology solutions were developed jointly with the various healthcare teams in the Ministry of Health and Social Services. Given the need for very rapid development, an evolutionary prototyping model was followed where the health workers specified their requirements through several iterative walkthroughs of the prototype until they were satisfied with the product. Allow me to also add that this work was completed while the teams were working remotely. So numerous Zoom sessions, demos, testing links, and product videos were produced. Quite often, the walkthrough and evaluation sessions were conducted in the middle of the night to allow for the medical doctors' hectic schedules. We are indeed very grateful to all the medical, IT, and service staff who formed part of this important initiative. Today, I shall be handing over these solutions to the Ministry of Health and Social Services for use and deployment throughout your ministry's facilities across our country. I'm informed that your information technology team has been very much part of this effort and has already begun the work for installation and deployment. The apps will be available for free to the public where the apps are intended for public use. The systems and data will be integrated into the existing health systems. Given the sensitivity of health data, the data management and access will remain the sole responsibility of your ministry, Honorable Minister. This will avoid any third-party access in order for the ministry to maintain privacy, confidentiality, and data protection of health data. The development team will provide support, maintenance, updates, and upgrades until the end of July. Allow me now to thank everyone who worked on this product. There are many to mention, but I will just mention some of them. The healthcare case management team, particularly Dr. Ndati, who ensured that the standard operating procedures, workflows, and clinical legal compliance were met in accordance with the medical standards. The health surveillance team, the health psychosocial support team, the Homeless People's Parliament, the NDP Accelerator Lab, the Quebasin Environment Project, and the Unemployed Youth in Swakopmund and Walvis Bay, who co-designed and co-created in the initial Homeless app on which the adaptations were based. The UNAM staff and students, in particular, the Community Outreach Project led by Ms. Helga Zaire, the NAST Faculty of Computing and Informatics, in particular, Ms. Josephine Muntumo, Technical Lead for the Design and Development, Dr. Swama Hamutenya, Self-Reporting System Project Leader, students from different institutions, and the Green Enterprise Solutions, who volunteered their developers, resources, and time for free to work alongside the inter-university development team. I think this is now the time for me to hand over to you the solutions. Honorable Minister, if you can come forward.
Thank you very much. I am a little bit vertically challenged, so I need something to assist me. Program Director, Professor Kavishe, Honorable Minister of Higher Education, Technology and Innovation, ladies and gentlemen, before I start, I must just state that we have, me and the Honorable Minister, we have made prior arrangement to speak out of the mask without posing any risk to anybody. We have just witnessed the launch of COVID-19 case management and surveillance technology toolkit. This is a welcome addition to our arsenal to fight COVID-19 here in Namibia. There are currently more than 4.6 million COVID-19 positive cases recorded globally, with more than 312,000 deaths. Namibia has now gone for 42 days without registering a new case of COVID-19. But we do still have COVID-19 patients in our health facility, and the global situation is not improving whatsoever. Therefore, we cannot afford to lower our guard. Appropriate case management and surveillance become more important as we move from lockdown to stage 2 of the state of emergency, during which a number of restrictions were relaxed. I applaud the Minister of Higher Education, Technology and Innovation, Dr. Ita Kanji Murangi, for having assembled a team of experts under the thematic area of epidemiology and forecasting to develop this toolkit. I want to stress the importance of data modeling solution that helps us to predict the course of the epidemic as we seek to migrate from one stage of the state of emergency to another. The state of emergency has understandably curtailed a number of activities. We need to have objective data that would help Namibia towards gradual easing of some restrictions. Experience has shown that a sudden easing of restriction without proper assessment of the situation has resulted in catastrophic situations where the gains of lockdowns were eroded by such action. Today we are closing week 2 of stage 2 of the state of emergency. Tomorrow we shall begin week 3 of stage 2. As I have stated on several occasions before, these are critical times in our efforts to fight COVID-19. The 73rd World Health Assembly will be officially opened today. The COVID-19 will take center stage over the next 2 days of virtual discussions. We hope to benefit from the wisdom of delegates and best practices that we can customize to our own situation in Namibia. Honorable Minister, ladies and gentlemen, it is my greatest pleasure and honor to receive the homemade COVID-19 case management and surveillance technology toolkit, and thank you and all those who were involved in its development. I thank you.
Thank you, Honorable Minister. I would like to mention at this stage, we have come to the end of stage 1 of this program, which is the launch, and we are going to allow the 2 Honorable Ministers to leave because they have other engagements, and then we shall enter stage 2, where the experts who develop this suite will be engaged in a panel discussion to have a detailed description of what is contained in the suite. So thank you very much. Thank you very much, honorable ministers, for being with us. And I thank you all for the conclusion of stage one. Thank you.